simple title sheet for the second of 4 of my March 1981 Venice Women's History Tapes, Women in Organizational and Community Health. A number of women could not attend, and quite a number of women did attend.
Hello, and welcome to one segment of the Venice Women's History Tapes. This portion is Women in Health. It features women involved with community healthcare organizations. Those assembled here have worked in organizational health in and around the Venice area for some length of time during the 1950s, 1960s, and or 1970s. Each participant has been asked to consider a set of questions prior to this discussion. Each person will address those questions in turn, and following the individual responses, there will be a general group discussion. I'm Linda Lux, and I'm tonight's moderator. I've lived in Venice since 1971, happily I may add, and I'm not professionally involved with any of the organizations represented here tonight, although I have visited several of them.
My name is Hope Blacker. I've lived in Venice for 15 years. I was the founding mother and first director for the West Side Women's Clinic. I'm also a former member of the Board of Medical Quality Assurance.
I'm Vivian Brown, Senior Deputy Director of D.D. Hirsch Community Mental Health Center, and I've lived in Venice for 5 years.
I'm Linda Mandel. I've lived in Venice since 1970, and I worked in Venice about 8 years, first at the County Health Department and also at the Venice Drug Coalition. I currently work at the California Women's Commission on Alcoholism.
I'm Lillian Tyler, and I'm the educator at the Tyler Clinic, which is not in Venice. However, the Venice Family Planning Center was started by my husband, Dr. Edward Tyler, who is now deceased. But with Helen Steiner, we found the location for the Venice Family Planning Center, and tonight I will be her voice.
I'm Janice Jones. I've lived in Venice for 18 years, since 1962. I've worked in Venice since 1965, and I work for the Venice Family Planning Center.
Hi, I'm Carol Klein, and I've lived and worked in Venice for the past 2 years. I'm administrator of the Los Angeles Childbirth Center, which is a prenatal clinic for women planning on home births.
I'm Mickey Selwyn. I've lived in Venice for 1 year, and prior to that I lived in Topanga for 7 years. I've worked in the Topanga, Venice area for all of that time, and I'm currently at the Los Angeles Childbirth Center where I'm a midwife.
The first question is, why do you live and or work in Venice? Why was your agency set up in Venice? What needs did the community have that your organization could meet or help with? What has your agency accomplished? What would you like to accomplish now and in the future? How has living and or working in Venice been a positive or negative experience to your organizational goals? What conflicts do you perceive in Venice, and how do you and your organization deal with them? What health and social problems in Venice do you feel are soluble and which are insoluble, and why?
Having only lived in Venice for 1 year, I'm the junior member of this panel, but I've always felt that Venice and Topanga were sort of the country and the city of the same sort of culture, and I feel very comfortable with it. The kinds of people who choose home birth are frequently people who live an alternative lifestyle, and I don't know exactly what that means anymore. It used to have a very definite meaning. You always saw long hair on the men and short hair on the women, and that was alternative. The idea of having a birth center is one that I think that many nurses and childbirth educators and people who are involved in home birth had wished for many, many years. And Venice seemed an ideal spot for it because there are a lot of people in Venice who seek an alternative to the standard kinds of care and treatment that they get in other places, not just for their health care, but for everything. There's a co-op, and there are all kinds of services that are found in this type of community. So it just seemed a logical place. And for myself to live here, when I moved in from the country, it was just a logical place to live. I'm fortunate in that I live within about 5 blocks of where I work, which I think everybody would love. Venice is a strange community to live in for, I think, most anybody, but when you've lived out in the country, in Topanga for a while, living in the city seems a bit formidable, and Venice hasn't been as formidable as I expected it to be. I feel as if I'm given a lot of privacy and space, and I feel very comfortable there. We, of course, hoped when we started the birth center in Venice that every woman in Venice who had a child would want to have one at home. And I can't say that that's happened. But I have certainly seen tremendous changes in the hospitals in the surrounding community, in Santa Monica, in Culver City, and Inglewood, and the various hospitals all around. And I think that one of the reasons that there is a change is because of the pressure that consumers are putting on the standard obstetrical types of practices to do things the way women and families want them done. So perhaps we've done something that we didn't intend to do, and it's turned out to be beneficial to a larger community than the one in which we're actually located.
I chose to work at the birth center because of my interest in women's health care and alternative births. And I'm living in this area because of the alternative lifestyles and the various people that live here. It seems to be there's a community feeling that the city is politically organized, which I don't find in other parts of Los Angeles. And I enjoy being near the beach and just the variety of people that live here. And the birth center just so happened that it was also located in Venice, so it seemed to all go together. I've chosen to work in this field because I think that birth right now is a very controversial issue, and I'm very interested in being part of an alternative that's supportive of giving people the right to choose the kind of atmosphere they want to birth in, and the importance of children coming into the world in a very gentle, nonviolent way, and that's what we support at the birth center. Initially, when I started, I wanted to come in and get the center running smoothly, and we were having a lot of problems in the neighborhood with a few neighbors who were, for some reason we still don't understand why, were antagonistic to the birth center, and I wanted to help smooth those problems over and get the birth center more financially stable. And we're doing better. We're doing a lot better now, but we still, because we want to serve low-income people, we offer a sliding scale, and our money situation is always tight. The problems I see living in Venice and working at the birth center, Venice contains a large Hispanic population, which in terms of health care, they're still somewhat isolated, and we have a hard time reaching out to them. And I think it's a major problem because you're living in Venice and they're a large population, and we seem to have a hard time bringing them together and letting them be aware that the birth center exists.
We lived in Venice, or we moved to Venice from Los Angeles due to the fact my husband had a job out here. And after that, we found a place, and since then, we bought a home here. I like the Venice community around because you get to be a part of the community. You get to help make policy. You get to be a part of what's happening. So that's what I like about Venice. As to why I've chosen the field that I'm in, it's just by circumstance, really. I mean, it fell on me. I started in 1965 working with one of the anti-poverty programs, and from that I went into the Venice Family Planning Center, worked there for 1 year with the anti-poverty program, and then was taken on as part of Venice Family Planning staff. And in the job, I feel like I really do help. You know, it's a good feeling, and I feel I do good work. What do I wish to accomplish? Personally, I would like to accomplish I would like to do educating for the teenagers. I'd like to help the teenagers I'd like to avoid some of the unwanted pregnancies that we have that seem to be quite a problem in the Venice community.
I agree that Janice does a bang-up job at the clinic and is a much enjoyed and much needed member of the staff. 16 years ago, Helen Steiner and I started the Venice Family Planning Center. It was then a very small unit, and it had a long time catching on in the community. But largely because she's such a super person that as soon as people started actually coming into our clinic, they found someone who had a great deal of love to offer and concern, and it permeated the community, and we started to have word-of-mouth referrals, which is the basis for most of the center's population that comes to us. The reason it started in Venice was that my husband was director at the time of the Family Planning Centers of Greater Los Angeles, and felt that this area of the city had been neglected as far as an opportunity for the women in this particular area to have family planning available to them. Family planning stands for every child a wanted child. So I'm kind of glad that I'm talking with the girls from the birth center who talk about gentle births and happy deliveries, because we like to see that every baby that's born is truly wanted, and that babies who are not wanted aren't even conceived. And it's possible with education and the right services to avoid pregnancy in our times today. But unfortunately, there's still a lot of people not aware of this or don't know how to cope with it. So I would like to see in the community much greater outreach and reciprocity. Quite a few times, because I'm basically an educator, I try to do educational sessions at our clinic. We find that people come for service, but whenever we set up an educational session that's outside of the time allotted for regular services, an evening group or a rap session or something, we have just a sprinkling of people and not a response. So my hope is that in the future we will get much more community cooperation, and I would love to see what Janice hopes for too, that we could get the teenagers truly involved so that we'll avoid these unwanted pregnancies.
Well, I've chosen to live in Venice. One big reason is because of the cultural diversity, also the age diversity, just all different kinds of people, artists and professionals and students. I've always kind of felt like an outsider, different than other people, sometimes not always accepted. But in Venice, I felt like a niche for myself. I've really felt accepted and part of all the variance involved here. I also like the clean air and the expanse of the ocean view. It's good for fantasizing and all kinds of things, you know. I've always felt pretty free in Venice, and I like that. It's been very helpful to my career and to my involvement with my work here in Venice, living here too. I found that I have become more trusted, more accepted in the community because of the fact that I do live here and have been involved in the things that have been going on. It's also been advantageous, I think, living and working here in the field of health, because there are so many talented and capable people, and I found especially women in Venice, to network with and to support each other and to start projects and get things going, and I've really liked that. I chose the field of health education to go into because I have wanted to help people. I knew I would be working in the human service field, yet I didn't feel my capabilities were particularly in direct service. I felt that I was strong in working with groups of people, and this is what I can do in health education. Also, I like turning people on to new things. The whole area of training has been something for me that I've enjoyed doing. And as far as working in drug and alcohol abuse, I've always been interested in consciousness alteration and these kinds of things. And this seemed like a way for me to explore these issues and see how they affect individuals and communities. Working with the County Department of Health Services on the whole west side, I chose to concentrate in the Venice area because that's where the drug problem, unfortunately, is most visible. And also, that is where I found, I was working alone when I was working here. I was kind of on my own a lot, and that's where, in Venice, where I found people who would really get involved to try to do something in their community and to try to make changes. So that's why I concentrated most of my time working in the Venice area. I think that one of the major areas that for accomplishments has been working in the area of women and substance abuse, women in alcohol and drug abuse. In Venice, organizing with women here, we started a women's consciousness raising group in one of the local drug abuse programs, and I think that was very successful, and our ideas, I think, have spread around the country concerning that work that we've done there. On the possibly negative side of living in Venice, as far as conflicts, things that are happening now, I see it's almost becoming a cliche to live here, and I don't like that. And it may mean that I might be moving out of Venice. I don't like the influx of a lot of people with a lot of money. I think the transition is very difficult now, and that is uncomfortable for me. And so I might move on at some time in the near future, I don't know.
My fields are mental health and substance abuse. It's kind of hard to remember why I went into those fields. It's been so long ago. But I remember very clearly why I went into community mental health. And that's because I wanted to not only impact on individuals, but to attempt to impact on communities and hopefully society sometime in my lifetime. And the D.D. Hirsch Community Mental Health Center and Benjamin Rush Center decided to set up a crisis intervention center in Venice in 1965. We opened the doors January 66. And what we wanted to do was to provide services, immediate intervention for anyone who wanted those services, and to provide them particularly for people who may never have utilized a mental health facility, either because there were none or because there were barriers, financial barriers or cultural barriers. That was our initial wish, and I think after living and working here for a short while, I realized I wanted to accomplish much more than that. The community needed many more services than just crisis intervention services. There were inadequate health services. There were no drug and alcohol programs at that time. And so one of the other commitments, one of the other wishes, was to at least try to get those services provided too. And what have I accomplished? Well, the first thing, and I guess this is really important, was that I met a family, a real family in Venice, and we accomplished a hell of a lot together. In terms of our particular accomplishments for the D.D. Hirsch Community Mental Health Center and the Benjamin Rush Center that opened, we were able to provide the services we wanted to, and we were able to expand the services. But that was just part of the beginning part of the journey. This incredible family that adopted me in Venice set about working together. We formed the Venice Health Council, and while we sometimes attacked the health establishment, including the universities and the county health department, we were able to collaborate with them and to open and establish the dental clinic and the community family health center. After that victory, we went on to form the Venice Drug Coalition, and we were able to implement one of the most comprehensive drug treatment programs in a community. And many of us still exist, and we still have our drug programs. My particular drug program is a residential treatment program. It began as a methadone maintenance residence, and it was the first of its kind in California. And we now serve not only methadone maintenance clients, but drug-free clients, women and children, and pregnant addicts. And we are quite pleased we are still around and still being innovative and providing services to a population that really was neglected, women addicts. We were also able to implement a comprehensive rape prevention program in Venice and neighboring areas. And I'm pretty pleased about those accomplishments. What would I like to accomplish? Well, I would like to see the entire family, the family that adopted me, have no one oppressed and no one victimized. And I hope I live to see that.
Well, I initially came to Venice because I was a potter, and there was a very large cooperative pottery studio in Venice at that time, which has since closed, and because I liked the ocean. And being on the beachfront, I talk to women a lot, and one of the things women gossip about is what they're doing about their family planning and what they're doing about VD and how they felt about the last abortion they had. And so over the years, being kind of a little beachfront hippie, that the thought that cooking brown rice was a real important adventure in life, and maybe embroidering a few jeans, I actually heard a lot about what women in this community thought about those subjects. And when the women's movement came along, I was sort of swept up in it, spoke to a lot in my personal life and to a lot of my personal oppression. And one of the things the women's movement said was that we should all go start feminist clinics. It was the right-on thing to do. And so I said, well, okay, I could live with that challenge. And I felt that this area was a really good area for a feminist clinic because I felt that there were a lot of women committed to a feminist ideology who could help and work to make the place a successful place, and who needed and would be more successful in terms of accomplishing their feminist goals if they were working within a feminist context, as opposed to what we were doing then, which is I was a legal secretary in Beverly Hills and doing this in our evenings and so on. Made it harder to work for the movement than when you've got that kind of job. We actually didn't set up in Venice. Partially because the only place for rent was right across the street from Venice Family Planning, and we thought that would be downright rude. And also because we wanted to have evening clinics for working women, and we wanted to be in a safe neighborhood, so we chose a location at 17th and Ocean Park Boulevard, which is easy to get to by bus from Venice. And at the same time, we've never heard from women that they were genuinely afraid, either the staff women or the women coming for services. Venice Family Clinic doesn't have evening sessions, and I sympathize with why one wouldn't want to in that neighborhood. What did we hope to accomplish? Well, we wanted to build a place for which women could conquer the world, right? Most importantly, at the time we started, abortion was still considered dangerous. In order to keep women from wanting abortions, one of the myths that had been set up was, well, maybe you've got a right to it, but gee, you don't want to do that. You'd get killed. You know, all that kind of very scary stuff. And to some extent, abortions had been scary because they had been done by the wrong people with the wrong motives in our society. So setting up a freestanding abortion clinic was a very important statement, political statement as to the safety of abortion, that it didn't have to be done in a hospital, that it was no more dangerous than a dentist visit, and that we really could do that. And some people were very shocked that we're not in a hospital. They'd say, where do you do your abortions? And we'd say, right over there. And they'd look at me like I just told them there was an elephant in the room, And I think it was very important to dispel some of those myths at that time and to show that women in a community setting could provide a very safe abortion service. And I think that we accomplished that. And we also showed that we could manage other resources such as physicians and money and so on. And, it was a real big statement because we owned the clinic and we hired the doctors. And if we didn't like the doctors, we could fire the doctors. That was a lot of power, even though it was a tiny clinic and we didn't do millions of abortions. Just the idea that we could do that and that we ran our lives in that way was all big steps forward. And I think that we accomplished a lot because what was especially gratifying to me was some of our older patients in their late 40s, early 50s, because they really remembered when abortion was different. Many of them had abortions at the younger time when it was more typical to have abortions, and they'd come in and they just couldn't believe that everything was neat and clean and people were kind, and there were real doctors who were actually being courteous to them and stuff, and it was just like for them, suddenly we'd accomplished something. We really had moved forward.
What have been the problems of outreach and why?
Well, part of it has to do, I guess, with the traditional cultural attitudes of certain of the ethnic community groups. The Hispanic group, for example, resist the idea as families of coming to a birth control center or family planning, which I much prefer to use as our our name because that's what it really is. However, some women do come in spite of great, religious and cultural hang-ups about using a service like that, and it's often without the consent of their community or their churches or their friends. And at one time we had a coffee clutch idea to go into the homes to get one of our clients who was coming to the clinic to open up her house, to invite in her neighbors, and I was very happy to go, and so was Helen Steiner and a few others of our dedicated workers, to take coffee and drinks, soft drinks and refreshments, and go to their homes and speak, whether it would be 4 to 6 or 10 people or even 2 or 3. But what we found was we were talking to our clients, that we weren't getting anybody else coming in, and it was very frustrating. Similarly, when we planned an evening, we'd have some interesting film, not always just reproductive or physiological, but about families and groups and cultural things to get them to come in and be there, and so we could talk. And they didn't come, and I'm still frustrated about it. I'd like to know how do you probe into the heart of the community?
Well, in terms of outreach, I don't think we really had a major problem. As we opened the doors, of course, the first day we did, I don't think anybody knew we had opened our doors except the staff, but what we had set up was immediate, no waiting. Someone could come to us with some problem of living. They would not have to sit for 3 hours waiting for their appointment, and they did not have to make a long-term contract for psychotherapy. It was crisis intervention, maximum of 6 visits, and we really found that it was much more fitting. It fit with the community style. It was not a traditional psychiatric center. In those years, of course, many people went on methadone maintenance. They did not receive any of the supportive services, and we were offering that. We were offering them a residential program. It was amazing. When I first wrote the proposal, I was told that this was a crazy idea because all you had to do was give these people methadone, and they should be able to go out in the street and work and be, normal citizens. And the methadone maintenance clients thought it was a great idea, and so they came into the residence and realized, and they told us very clearly, they had cleaned up 20, 25 times in their lives, but it was the staying clean. Mm-hmm. And they were worried that without some other support, they wouldn't be able to make it.
If we want to look also as far as substance abuse and looking at women specifically, I think there was and there still is some problem there with women feeling free enough to come in for help in terms of drug abuse and alcoholism especially. A lot of it has to do with double standards in our society, the stigma that it's somehow sinful, immoral for a woman to have problems with substances, with chemicals, more so than men. A lot of it had to do with the fact that some of the programs were run mostly by men, that there weren't a lot of women counselors. There were more of those, but there certainly weren't many women administrators, role models, people that women could identify with. Then the child care issue was a problem. That was always difficult in terms of, are you going to lose your child? Will you be labeled a bad mother? There were all kinds of problems that made it difficult. Plus, programs weren't designed. They were mainly designed for men in mind, and they didn't have special components to meet women's needs.
And I started to say, and will continue to say, that there are a lot of people in the state of California who are practicing midwifery and doing home birth. The biggest problem that comes up at any kind of meeting involving midwives and home birth is how to get backup, because doctors are in a position in which, even if they feel sympathetic toward the home birth movement and they would really like to help midwives and families out, the peer pressure is tremendous. If they start helping people who are interested in home birth, they find that their hospital privileges are endangered. So it's hard to find a doctor who's willing to work under those circumstances, and we are very fortunate at the Los Angeles Childbirth Center to have a doctor who's willing to do that. And we can't split him up in little pieces and send part of him to Visalia and another part to Sonoma, and we only have one. We would love to help other people set up projects like this. We've had people say, oh, can't you please come to Sierra Madre and deliver my baby? And we say, no, that's too far away. Well, can't you help somebody in this area get a birth center started like that? We'd love to, but we need the doctors. One of the things that is a big problem is that people can't just have babies at home without any thought to what else is going to go on. And there are also, the possibility of complications that you can't negate. And you have to have something that you can do about it, and you have to be able to handle whatever comes to you. So, we have the plan, and we would love to have other people do it. I don't know how to tell them how to find this doctor. I think one of the things that we've tried to do in our community is to make everybody feel as if the center is for them. I mean, it doesn't make any difference what their ethnic background is or what they may have done in the past as far as obstetrical care or health care of any kind. But it's very difficult to say this to somebody, for example, who has always equated home birth with not having enough money to go to the hospital. And we find that not just the Spanish-speaking, but poverty populations in general are sort of saying, well, I'm going to have the best for my baby. I'm going to have that great, big, beautiful general hospital up there on the hill. And when they get into the general hospital system and realize that it means depersonalized care and not feeling like a very human being, later they may say, I'd rather have something else for my subsequent births. But it's very hard to convince somebody to whom midwifery has always meant a granny and a dirt floor and that kind of thing, that isn't the modern midwife. So that's part of the outreach problem for us.
I think one of the important kinds of outreach that all of the programs that are represented here have had is our outreach in terms of our impact on the political system and the ways in which the various programs have changed how legislators and various people in government have envisioned these problems, because home birth and drug abuse and family planning have all gone through enormous changes in the past 10 and 15 years in terms of public acceptability and in terms of the kinds of, and with that, the kinds of programs that the government was willing to offer. I mean, it wasn't that long ago that, it wasn't that long ago. Reagan has just appointed somebody to head the Office of Teenage Pregnancy, who's talking about contraceptives not being the way to go. We have to teach kids not to do it in the first place. So, we're still back there when people really have all of these very prejudicial attitudes towards people who will have home births, towards people seeking contraceptive care, people seeking abortion, particularly very young people. People used to ask me, what is the youngest person who had an abortion at your clinic? And I tell them 13, and they go, I'd say, well, what do you expect her to do if she doesn't want the child? That was a very intelligent choice, And I'd say, and they would call me all kinds of names. One of them, I just told her I hadn't made anybody pregnant, And then also with substance abuse, the respectability of substance abuse programs and the respectability of women involved.
One of the major things was the child care. A woman who wanted to go into a drug treatment program, particularly if it was with residents, had to give up her child if she hadn't lost it because she was labeled a bad mother, incapable of taking care of the child. And so the programs that started to be innovative didn't sound very innovative to us. A woman should have her child with her if she would like that child with her. And so we allowed that to happen. The Women's Task Force took on that battle on a real political level and said this has to happen throughout the state of California. This is very important for women. The programs have to change. There have to be specific services for the women and for their children, and we need funding for them. And we were able to see at one point in time that there was funding available. Now, of course, I'm sure all of us are sitting here worried about money and budget cuts. The potential for my programs is that every single one of my programs can be affected. And that means mental health, and that means substance abuse. The Mental Health Systems Act was passed the appropriations, the allocations were not passed before Reagan was in office. At this point, what we are waiting to hear is that the block grants may come through, and if the block grants come through on October 1st, it means the entire Mental Health Systems Act is rescinded, and the era of community mental health centers may end, and we are told that all the drug programs may be cut drastically. The best word we're getting is 20%.
Right now, there seems to be a wave of so-called right, quotes, morality, which is negating sex education in the schools and going back to the idea that if you don't talk about it, it won't happen. And we thought, some good 10 years ago, it became respectable to talk to young people about contraception and make them responsible and aware of their possibility of pregnancy and the need to be responsible. And we've never found through education that people did things, but more because of ignorance that things happened to them. So it seems to me that we're going into a black period coming up where we're going to have retrenchment, and we've made progress in the last 10 years, beautiful progress, and I'm sad to think that it's going to be curtailed.
In the interest of outreach, I would just like to say the Venice Family Planning Center do have evening clinics, and we have had evening clinics for about 10 years. So we are open 2 evenings a week.
As far as the birth center, we are a private nonprofit clinic, so right now we're not existing on any public funding, although we do take Medi-Cal, so there is the possibility that with Medi-Cal cuts, a lot of our patient population is about 20% Medi-Cal, so it's a possibility that those people would be affected. And then on a larger scale, prenatal care in the county is going to be very drastically reduced.
The California Women's Commission on Alcoholism, we're starting to really look into foundations and industry in terms of donations from them, doing membership fundraising campaigns throughout the state. And the alcohol programs are somewhat fortunate now in that a bill was passed recently where they are going to get some of the money that is from drunk driving arrests and this kind of thing. So I think it behooves other agencies to start looking into these alternate sources of funds, maybe taxing drugs or
I'd like to mention that there's no representative here from the Venice Family Clinic, which serves the Chicano population of Venice, and I'm sorry that they didn't come, but I did want to make mention. We have mentioned them several times, but they definitely needed to be here tonight. What health patterns are currently prevalent now in terms of changes from the 60s?
As far as VD, herpes is a very rampant disease that's passed sexually, and I don't think enough people are aware of it. And women especially, happily now, some women are learning about their bodies and learning how to examine their bodies. And if they can observe initial sores and things that appear, maybe they'll be able to prevent the spread, because it's a very lasting and unhappy situation when these herpes attack the genital areas. But it happens to be the most rampant VD in our country now.
One of the things I've seen that is a problem in health is around that we see more repeated pregnancies in earlier ages now than we did in the 60s.
When I first began being involved with home birth people in the late 60s, they were mostly choosing home birth because to have a baby in the hospital meant that the mother and father were separated, that the mother was drugged, and a good many procedures and things were forced upon her, and the baby was taken away from her immediately after birth. And this is the reason that people chose to have their babies at home, to avoid these things. And it's wonderful to see that almost every hospital in Los Angeles now has an option for the father to be present at the birth, or some relative or a very good friend of the mother's is more or less invited to be a part of the birth experience. And while I would like to see them be a little more sensitive about allowing breastfeeding in a way in which the baby would actually have a chance to catch on to the breast, the fact that even the gesture is made to hand the baby to the mother after the birth, and that the mother doesn't feel like she's just sort of an incubator that carries the baby into the hospital and from whom the baby has to be removed by any force necessary, I think is a big step forward. while having the hospital births more pleasant inclines people not to have a home birth as much as, if they have something really horrible to avoid. I'm very glad that people who would ordinarily not perhaps choose to make their needs known are given an experience which in and of itself is a good experience, and that they receive it. It's just sort of a given now. So
there is being more concern focused on women's health issues in general, and I don't know, well, we'll have to see now if the money comes for that, because that shows really how seriously government people take the problem. But I know that the governor here in California has asked for input. There's now a women's health task force that is meeting here in Los Angeles, concerned with giving the governor information on what he should do, what his agencies should do, and the legislation and so forth on women's health issues. So I think that's a really important step.
Is your facility properly equipped to deal with the problems today? Is it currently properly equipped, and is it adequate to meet the needs of the community?
Of necessity, a facility that does abortions must always be properly equipped. It's part of the nature of medicine that you cannot be under-equipped. It's not like, I used to run a bead store, and if somebody came in and wanted amethyst beads and you were out of them, you just said, oh, well, we just don't have any. Come back in 2 weeks. Healthcare isn't like that. You absolutely must have the things that you must have. And if you find that you've run out of them on a given afternoon, you do whatever's necessary to get them in. If your supplier can't get them in time, you go bum them from somebody else or from a doctor's office that has them. There's no question, is it undersupplied or under-equipped? You cannot operate that way and operate a good operation that is safe and is ethical to your patients. Just no two ways around it. And I'm pleased to see that the West Side not only remains properly equipped, but has finally gotten the money to really redo the facilities and to put in prettier color linoleum, and some of the rugs that have been worn out in the waiting room and so on and so forth are being replaced so that the place will be looking every bit as clean and modern as it ought to be.
Janice was thoughtful enough to bring along this display here, which you can focus on, and this shows you some of how we're equipped. The Venice Family Planning Center is equipped to offer all kinds of alternative methods of birth control and teach the different methods so that people have the opportunity to have a choice. And one of the things that my husband proposed and was an advocate of long ago was that there isn't any one method that's ideal for all women, but that each woman is an individual and her particular needs are individual, and therefore it's most important that birth control be geared to the individual. And that's one of the things we really stress in our Venice Center.
The birth center also offers a gynecology and family planning practice, and we've been able to get approval by the FDA to offer cervical caps, which is a new method. It's not really new. It's been used in England and Europe for a long time, but it's new in America. So we are also able to offer this, which a lot of people in the city are coming to the center to get because it's not widely available. And we also offer a pediatric practice that encourages our couples that have had home birth to keep coming back to the birth center and see the pediatrician.
Lest anybody be confused, the birth center is not the place where women give birth. They come to the birth center for prenatal care and for childbirth education and for pediatric care and gynecological care, but the site of the birth is in their homes, and those are as adequate as the family is able to make them. Sometimes we wish they could be more adequate, because when we come into somebody's home and we see that they really are having a hard time getting along, that 4 or 5 people are living in 2 rooms and that there isn't an awful lot of food in the refrigerator and so forth, we don't like to see that. But I don't know how we're going to change that, particularly with the new administration. So what I really wanted to say is that I don't want people to feel when we're talking about equipment and is the equipment adequate, that the births are taking place at the birth center and that there should be a lot of emergency equipment available at the birth center, because it isn't, and we don't do the births there.
just wanted to ask a question. We have a lot of calls for the cervical cap. Will you supply women who do not come in to you for prenatal care? You will. Okay.
Some networking is going on. Spread the word. I realized also that the County Free Clinic person is not here tonight, and I have questions in terms of not just female care, health care, but agencies that serve the community in terms of when you're sick. And the two that aren't represented here are just those two, which is unfortunate.
There are 3 clinics on Venice Boulevard. There's the youth clinic, there's the family clinic on Lincoln near Rose, and then the county health department, which is not strictly in Venice, it's in Santa Monica at 26th or 28th and Pico, all 3 of which provide general health care clinics for the same population.
Although I'm not affiliated with the Venice Family Clinic, I know a bit about it, and they have about 100 doctors available who are volunteers, and from all phases of medicine. They offer internal medical care, they offer specific care for specific diseases and illnesses, and in general it's really a working clinic for a large population, and it covers all aspects of medicine.
All of these areas emerging from eras of persecution for us as providers and persecution for our clients. Of course, drug abuse has most seriously suffered from persecution of its clients, but I think I certainly know Mickey well remembers the day when people seeking home birth were called all sorts of nasty names. And it's a long time, at least in California, since people seeking contraception have been persecuted. But I still know that in the early 70s, the Feminist Women's Health Center was involved in a big raid by the DA's office, and John Marshall, head of obstetrics and gynecology at Harvard General Hospital, an eminently respectable physician who ran an innovative training program for women healthcare workers, some of whom work in the family planning clinics. The Board of Medical Examiners sent the police in after him, which to me seems just shocking that a man of such eminence would have the police visiting his office. I think that one of the changes that we're seeing in the 70s has been a gradual emergence from this kind of persecution. And of course, abortion patients were persecuted, and of course, if Reagan has his way, they'll be persecuted for murder. Not very attractive thought. So on the one hand, we're emerging from some of this persecution, and just as we were starting to emerge from some of this persecution and gain respectability both as providers and respectability for our clients, that it was okay for them to want these services, it's okay to need to go in for VD testing, et cetera, et cetera. We come upon a smashing era of repression, which is repression directed towards us as providers and repression directed towards our clients as groups. And I can speak very personally about it because I spent a long time with the Board of Medical Quality Assurance, which in the early 70s was viewed somewhat as the Gestapo in medicine. They were responsible for the investigation of the Feminist Women's Health Center. They were responsible for the arrest of a number of midwives. And in most people's view, they didn't do anything else particularly useful. And I think that there has been an attempt on that organization's part to change. And they will be introducing some new legislation into the state which will decriminalize midwifery. And for that group to be introducing that legislation represents some major political movement forward. At the same time, we just saw a bill passed in the state which requires physicians to report sexually active women under the age of 18. A monumentally, threatening piece of legislation to our clients. So it's like, or even more frighteningly upon us, and even more, like I get more angry because you expected people to have learned. Whereas in the early 70s, you figured, well, they haven't been educated, and, well, they still think abortion is dangerous because
The doctors banded together and objected. They said that client information is confidential, that ministers and lawyers and doctors are pledged to keep secret what their clients tell them, and that it's an abuse of personal freedom, and they will not comply with that law. And there's already another law in the books that's about to be passed, and I think at least today we've moved far enough ahead so the doctors are now cooperating in this degree, because it would be really a horrendous and outrageous thing if that terrible kind of legislation remained on the books.
I'd like to say a few words about the 1980s. I'd like to think that it was both positive and negative. The negative, everything that I think we've learned may suddenly be thrown in our faces and taken away. That's the bad part. I would like to talk a little bit about maybe the positive part, what we have learned and what we would like to be doing in the 80s. I think, one of the things that mental health has been accused of is that we don't know the answers. We keep trying to prevent mental disorder, and we don't know how to tell people to do that. How to do that? Well, I think we do know some things, and I think we know that poverty causes problems, and I think we know that racism causes problems, and I think we know that sexism causes problems. I don't think we need more research to demonstrate that. I think we've learned it, and I think we knew how to begin some programs to try to change that. In terms of some of the real increase in expanding services for women in our field, for sexual assault victims and for battered women, I think we've come a long way. And I don't think we can be stopped. I think we can be cut. I think we can have very hard times, but I think that we have learned the networking, and we've always known how to get along on limited resources. So we need to, I think, collaborate with one another and network a little more and really share the resources. With the drug prevention, the same. I think we have just begun to know some things about how to prevent drugs. I mean, Linda was asking about what happened from the 60s to the 80s. Well, in the 60s, we were picking people up with LSD and overdoses with barbiturates, and then we moved into the glue sniffing, and now we're at the PCP. So our drug prevention work has not been too successful. We haven't kept ahead of the drugs. But we do have some good ideas. We've got many years of experience now. And those programs will probably be the first to be cut if drug programs are cut. So I think, again, we're going to have to learn to not only share material resources, but our brains, and come up with some very innovative ways to continue that programming. I'd hate to see any of it stopped, and I guess I'm very optimistic. We should not stop.
Well, it looks as though ERA is doomed as of, the new administration. But I feel like underneath and pulsating throughout the entire country from coast to coast, women have come alive and are coming aware. And I don't think that any particular regime, or Reaganism for 4 years or what have you, is going to stem the tide of the new woman. We have arrived, we're aware, we're much more forceful, we're beginning to be concerned about ourselves and our bodies and take a role for independence in all areas, our sex, our homes, our economics, etc. And I don't think whether ERA passes or doesn't pass that it's going to stop women.
That's good enough. The Venice Women's History Tapes is a piece of history. I think the 80s will be bringing many new things, but Mrs. Tyler said it. Women have come alive, and nothing's going to stop us. Thank you for watching.
Thank you.